Darlene Rogers Heath. Hey, how are you doing? And thank you so much for the greetings. How to lower your cholesterol? You can lower your cholesterol naturally by taking eating foods that are high in omega-3 fish oils, taking omega-3 fish oils supplements, and that's fish oil. And if you have food or fish allergies, there are other omega-3 oil options like flaxseed oil that have no seafood components in them that you can take. Also, red yeast rice is very good for lowering the cholesterol. And then a vegan diet, pescatarian at minimum. And your preferred method of food preparation is baked or broiled, not fried. So when you have an option of getting fried chicken or getting the baked rotisserie chicken that they have in the deli section of every grocery store now for $6 that'll feed a whole family, it's the greatest deal going, and they taste amazing. So good baked or broiled versus fried. Minimize the amount of fatty foods in your diet, and then things like red yeast rice. Apple cider vinegar is also good for lowering your cholesterol. Garlic will lower your cholesterol as well. Not eating it is the best way to go. Now, if your cholesterol, the normal range of cholesterol is less than 200 for a total cholesterol level. If your cholesterol is 300, you don't need to waste time trying those things. They will drop it 20 points, but you need to drop it 100 points. So you're going to need to be on a medication that will do so. The class of drugs that do that the best are a class of drugs called statins. There are three major ones. There's Zocor or simvastatin, there's Lipitor or atorvastatin, and there's Crestor or rovastatin. There's also one called Livalo, which is very good and more potent and has least amount of side effects if you respond to side effects. Most people have no side effects with statin class drugs, but about 2% of people will have muscle aches. Not joint pain, but muscle aches, and usually the large muscles of your body, like your thighs and your back. So if you're having, just pain in your extremities or whatever, it's probably just arthritis. But oftentimes that medication will get credit for it. So that's what you can do to lower your cholesterol, Darlene. Get it done. Coordinate with your primary care provider. If it requires medication, embrace that need. What I do with my patients is this. I say, let's go on the medicine for 3 months, get your cholesterol down, and then if you try to keep it down with diet and exercise program, versus what people want to do, which is let me try for 3 months or 6 months to see if I can get it down by following a diet and exercise program. That works probably 2% of the time. The vast majority of the time, it does not work. But if you lower it with the medication and then trying to keep it down, one, you're motivated to do so. Two, once you're starting from it's much easier to keep it down than it is to bring it down with a diet and exercise program. So I'd recommend just embracing the need to do it and say, okay, I have high cholesterol. I need to lower my cholesterol because people die in the United States from heart attacks and strokes caused by high cholesterol and uncontrolled high blood pressure. These numbers are disproportionately represented by people of color. I mean, Black and brown people. So it's just a simple and easy thing to do to just control that cholesterol level by taking the medication. So understand that if there's a need for it, if the doctor's prescribing it, just embrace it and say, okay, and do it. But your cholesterol lowering medications, the easiest to get, the most effective, the best impact on your cardiovascular health, yet the one that people give you the most resistance for taking for whatever reason. But in Dr. Collier's trifecta, we have the omega-3 fish oil as one of the things you should take. Omega-3 fish oil will lower your total cholesterol. It will increase your HDL or good cholesterol. It will lower your LDL or bad cholesterol, and it will lower your triglycerides. So that's a very good way and a natural way to lower your cholesterol by taking omega-3 fish oil. It causes and decreases inflammation, and it also helps decrease your chance of having a heart attack or a stroke. So you can't go wrong with omega-3 fish oil. You've heard me say a good omega-3 fish oil product should be crystal clear when you look at the capsule. And also when you open the bottle, it should not smell fishy. If it smells fishy or if the capsule is cloudy, then that is a poorly prepared product and probably not one you want to take. In addition, if you take that, it gets into your bloodstream, and now all of your body fluids will taste and smell fishy. So when you perspire, you're going to smell fishy. When you sweat, you're going to smell fishy. Your saliva will taste fishy. All your other body fluids will taste fishy or smell fishy. Never a good time to do that. ladies or gentlemen. Never a good time to do that. So make sure you get a good omega-3 fish oil product. You can go to the website, lipodrops.com. Our omega-3 fish oil is one of the best. It's ultra centrifuged and purified. The capsules are crystal clear. You can see right through them. And you open the bottle, you smell nothing. There's no oily or fishy smell, and they sit quite well on your stomach. All right, great question.